Today we will study about spinal cord bones. The human spine is also known as the vertebral column is composed of 33 individual bones called vertebra. These vertebra are stacked on the top of each other forming a series of interlocking structures. The spinal cord is divided into 5 regions: cervical, thoracic, lumbar, sacral and coccygeal. Spinal cord anatomy: cervical vertebra, that is C1 to C7, thoracic vertebra T1 to T12, lumbar vertebra L1 to L5, sacrum and coccyx. Cervical spine neck: this region contains 7 vertebrae and supports the weight of the head. Thoracic spine upper back: this region consists of 12 vertebrae and is connected to ribs. Lumbar spine lower back: this region has 5 vertebrae and supports the weight of the upper body. Sacral spine: the sacrum is formed by the fusion of 5 vertebrae and connects the spine to the pelvis. Coccygeal spine tailbone: the coccyx is formed by the fusion of 4 vertebrae and is located at the very bottom of the spine. Functions of the vertebra: supports the vertebra supports the weight of the head, trunk and upper body. Protection: the vertebral canal formed by the vertebra have holes in the vertebral encloses and protects the spinal cord. Movement: the vertebral articulate with each other allowing for a wide range of spinal movements. Attachment sites: the vertebra provides attachment points for muscles, ligaments, and tendons. The sacrum and the coccygeal formed by the fusion of multiple vertebrae in the adult spine. The vertebrae are separated by intervertebral discs which acts as shock absorber. The spine is a dynamic structure that is consistently adapting to a stress placed on it. Pelvis is the seat of your axial skeletal, the central core of your skeletal system. It holds up your trunk and connects it with your legs below. Pelvic bones form a sort of basin at the base of your spine with an opening in the middle. These are the bones of your hip, buttocks, and pubic area. 5 separate bones combine to form your bony pelvis. First one is sacrum. It is a S-shaped bone at the base of your spine. It forms when the last 5 vertebrae of your spine fuse together, a process that takes place until puberty to complete. Coccyx is a tailbone, the small fine bone at the tip of your spine and sacrum. Healthcare providers sometimes refer to sacrum and coccyx together pelvic spine. Ilium, ischium and pubis make up your pelvic girdle, the bones that encircle pelvic spine. These bones also are separate in childhood and fuse together during puberty. Ischium, singular or ischia plural, are sit bones. The two U-shaped bones hang from the base of the pelvic girdle and form the bony part of the buttocks. Pubis or pubic bone is the smallest bone on each side of the pelvis. Your two pubic bones meet in the front and center of your pelvis at a joint called pubic symphysis. Rib cage. The human rib cage or thoracic cage is composed of 12 pairs of ribs that form a protective structure around the chest, protecting the heart and lungs. Human rib cage. True ribs from 1 to 7, false ribs from 8 to 12. Costal cartilage. These ribs articulate posteriorly with the thoracic vertebra and connects anteriorly to the sternum, breastbone, via costal cartilage. The ribs are classified as true, false, and floating based on their attachment to the sternum. Anatomy of a typical rib. Head, a bony prominence that articulate with the thoracic vertebra. Neck, a narrowed area between the head and the soft chuff. The main body of the rib, a curved flattened bone. A small projection on the posterior surface of the neck that articulate with the transfer process of the vertebra. Costal groove, a groove on the inner surface of the rib that house the intercostal neurovascular bundles, veins, arteries, and nerves. Rib classification. True ribs 1 to 7. These connect directly to the sternum via costal cartilage. False ribs 8 to 10. These connect to the sternum indirectly via the costal cartilage of the rib above them. Floating ribs 11th and 12th rib. These do not connect to the sternum and terminate in the abdominal muscle. Atypical ribs. The first rib is shorter and wider with only one articular pheasant for articulation with the first thoracic vertebra. The second rib is longer and thinner with a rough-edged area on its upper surface for the origin of the anterior muscle. The tenth rib has only one articular facet on its head. The 11th and 12th rib have no neck and only one articular facet. Functions of the ribs. Protection. The rib cage protects the vital organs in the chest, including the heart and lungs. Respiration. The ribs play a crucial role in breathing, expanding, and contracting with the lungs. Attachments. The ribs serve as attachment point for various muscles including the intercostal muscles and the diaphragm. Leg bones. The major bones in the human leg are the femur, thigh bone, patella, kneecap, tibia, shin bone, and fibula, smaller lower leg bone. Additionally, the foot contains tarsal, metatarsals, and phalanges, that is, toe bones. Femur, the longest bone in the body located in the thigh. Patella, a small triangular bone located in the front of the knee joint. Tibia, the larger of the two bones in the lower leg, also known as the shin bone. Fibula, the smaller of the two bones in the lower leg located on the outer side of the tibia. Tarsals, the seven bones that make up the ankle and hind foot. Metatarsals, the five long bones that make up the main part of the foot between the tarsals and the toe bones. Phalanges, the bones that make up the toes, with each toe having three phalanges except the big toe, which has one.